So the Common Advice Performance Management Reporting Framework measures key performance indicators for money and welfare rights advice services funded by local authorities on both an in-house and commission basis. So this is the 7th year of the framework and the 4th year to include both money and welfare rights advice. And the national report, statistical summary, and the individual local authority reports should be published this month. So they're currently being put together by our comms team, but hopefully you've all had a chance to look at that before now. So the report for this year covers the 2020-2021 financial year, and that's the first year to cover the COVID-19 pandemic, which demonstrates the impact this has had on the working practices of these services, as well as the demand that they've been facing. So on to the key points from this report. So local authorities have continued to make substantial investment in advice services. So in 2020-21, local authorities reported approximately £16.2 million was invested in internally delivered services, and then a further £10.8 million was invested in commissioning external services. So overall, the local authority figures suggest that there's been an increase over the past 4 years, so between 2017-18 and 2020-21. But then it looks as though there's been a decrease over the past year, so between 2019-20 and 2020-21. So if you account for the effects of inflation, so the fact that there's obviously increased costs over this time, and if you only include local authorities that were able to report full figures each year, then it looks as though there's an overall increase of 2% over the 4 years and a reduction of 7% over the past year. So the reduction that we're seeing over the past year can partly be explained because in previous years, some services had included other areas of advice in that funding. So local authority funding that was covering other advice aside from money and welfare rights advice. But this year we asked specifically what proportion of that funding went towards money and welfare rights advice, and then adjusted the figures accordingly. So there has been a slight reduction due to that. But there was some services that noted that these reductions were genuine, and in some cases it was because there was the removal of funds due to vacant posts and such like. And although there has been an overall reduction, there were services who found they had an increase in funding over the past year, and for a lot of them it was related to increased staffing costs, so particularly for local authority services where they've got the annual pay award. And for some services there was increases in funding to support COVID-19 related activities. So that additional funding was actually going towards specific activities. So the investment that local authorities makes also attracts further investment from other funders. So this year there was approximately £7.8 million secured from other funders, with the Scottish Legal Aid Board and the Scottish Government accounting for a large proportion of this additional funding. This additional funding appears to have increased over the past year, and although part of that might be because there's been improvements in reporting, there was a few services that did mention that there was new funding made available to support with COVID-19. So where there has been increases in funding, that's most likely due to the additional activities that have been expected during this time. So the demographic groups in the current report remain broadly similar to previous years. However, there has been slight changes which might indicate a change in the type of person that's been seeking money and welfare rights advice. So some of the groups that we've seen changes in are the proportion of female clients. So this increased 2% between 2019-20 and 2021, and is now makes up a higher proportion than in the Scottish population. There was also a greater proportion of clients from ethnic minority backgrounds, and there's a greater proportion of younger clients. So the clients aged 60 and above continue to make up the largest proportion of clients, but this group fell by 7% over the past year. So there's now a larger proportion of younger people. There are also some slight changes in the economic backgrounds of clients, with greater proportions from higher income groups and growth in those who are unemployed and seeking work. So these results do suggest that there's possibly higher numbers seeking advice who may never have done so previously. However, the changes are still small, and it's likely that because of the sort of support measures that were available during this time, we've not seen the same influx of clients from different demographic groups that we might have expected otherwise. But it should also be noted that the demographic groups that typically access advice, so people with disabilities, those with low income, and older clients, these groups were some of the most vulnerable in society and were particularly vulnerable to the economic impact of the pandemic. Therefore, it's expected that these groups would continue to make up a large proportion of clients. And it is possible that the demographics of clients may continue to change more significantly in the longer term as the overall impact of the pandemic continues to unfold, and especially now that we're seeing rises in fuel prices and things like that. So there has been a notable change, obviously, in the delivery of advice services, but this has also had an impact on the demand. So services have adapted quickly to the challenges faced by COVID-19, with advisors working from home and service delivery shifting away from face-to-face. So telephone appointments became more common over the past year, as did digital appointments, as services worked to ensure that support was still available, regardless of being able to see people face-to-face. The figures suggest that there's been an overall reduction in demand for advice during 2020-21. So the total number of reported clients reduced, and this reduction is seen across debt advice and welfare rights advice. So the reduction is likely related to the support measures put in place during this time. So the furlough scheme prevented a drastic rise in unemployment, and payment breaks and forbearance measures meant that there wasn't the same urgency to address outstanding debt. We've also saw that some welfare benefit award periods were automatically extended, and conditionality requirements were removed. So that's resulted in fewer adverse decisions, and therefore fewer clients seeking support disputing those decisions. So that's had an impact on the number of mandatory reconsiderations and appeals that have been supported over that year. There was an increase in the reported benefit entitlement checks carried out in 2021. So this could be again due to improved reporting, but it's likely to reflect an increase in people needing to know what support was available to them, because the welfare system had changed so significantly during this time. There's also likely to be an increase in people who maybe never had access to welfare benefits before, and so wanted to know what they could be entitled to. And there was also an increase in new clients, despite the overall increase in clients, which could support the theory that there's been new clients that had never needed this support before. We've also seen an increase in the proportion of clients who had access services through referrals from other organisations and local authority services. So most services did highlight that as a result of the pandemic, there's been better linkages between different local authority services and other organisations, and there's been a greater awareness of the support that these services can provide, and this has led to greater numbers of referrals. But it's also the lack of face-to-face drop-in sessions has also meant that the referrals from organisations were probably the more likely route for people to access services during this time. And so whilst there has been an overall reduction in demand, that's not to say that services weren't busy during this time. There was obviously a lot of time needed to adapt to the new ways of working. Some of these processes were more complicated and more lengthy, and so services continued to face a lot of demand, even if the numbers weren't quite as high as previous years. And despite the overall reduction in volume, services have continued to achieve successful outcomes for clients. So a reported 61,153 welfare benefit claims were awarded as a result of the support provided from these services. And of the possible outcomes for debt clients, a debt strategy was agreed in 75% of cases. Significant levels of financial gain were achieved, with £315.6 million reported. And as in previous years, this represents excellent value for money, with £1 of local authority funding resulting in £12 financial gain for clients. So this demonstrates that the benefit of advice far exceeds the cost. And it should be noted that a lot of the time for services, it's not always possible to verify financial gain or to record an outcome, which has been particularly challenging over the past year when services have had people, you know, going for benefit entitlement checks and then potentially go and apply for the benefit themselves, and the service never hears if they were awarded. So it's likely that more financial gain is achieved than what is presented here. Benefits advice services have also go beyond financial gain, with the clients self-reporting improvements in well-being and stability, and often noting that the reassurance that the support from these services can provide. So that's sort of been particularly vital during the past year when people have faced so much uncertainty. Having that support available has just been a real lifeline for a lot of people. The work done by these services also prevent serious negative outcomes such as homelessness and court action, and services act as a central point of for linking up clients with other services. So all of this has been achieved during a challenging year for everyone, with significant changes to the sector and the economic climate. And the additional research that we'll move on to soon further emphasises the value of these services during the challenges of the past year. So that's just a quick run through of the findings of the report. So now is just a chance if you've got any questions or any comments that you'd like to make. So yeah, either just put your hand up or pop it in the chat. So we'll have a couple of minutes for that. Okay, so the next part is we're going to discuss the research that we carried out last year. So this is basically an insight from service leads and advisors on what's been going on over the past year. So through this research, the Improvement Service aimed to gain an insight into some of the areas that are not necessarily well understood by the common advice data alone. So this came off the back of last year's workshop. We'd asked about things that people would be interested in doing some research on, so that's where this has come from. So several changes have taken place within the sector since the start of the COVID-19 pandemic. So we wanted to understand better what's actually happened and get an idea from service leads and advisors who have knowledge of this firsthand. So there was three main aims set out for the research. So first, to provide a more detailed understanding of the support provided by local authority funded money and welfare rights advice services and what this achieves. Then an understanding of how the COVID-19 pandemic has impacted the work done by these services, including the impact on face-to-face service delivery. And finally, an insight into how services are supporting clients with debt and preventing debt. So just like to first of all say thanks to those of you who took the time to contribute to the research and shared your insight. It was all really useful and we couldn't have done it without your input. So thanks to those of you who were able to do that. So the research had three parts to it. So the first part was a survey of advice leads. So all services were given the chance to complete the survey, and it had a range of quantitative and qualitative questions relating to how advice is delivered within the service, how this has changed, and then future plans for the service. We then carried out a couple of follow-up interviews with some participants from the survey, just to ask questions relating to the key themes that were emerging from the survey results. And then we also did some advisor logs. So these were logs completed by advisors within money and welfare rights advice services. So a template was created with questions that related to the support provided to clients, and advisors recorded answers in relation to each of the clients they supported during the day. And to get a sense of what we understanding that there's not a typical day within advice, most of these advisors recorded the log over multiple days, with the majority doing this over 3 days. And these were completed during October last year, so it gives a sort of snapshot of what was going on at that time. So looking basically like a year into the pandemic, what was sort of changing at that point. So first, looking at the sort of typical support that's provided within money and welfare rights advice services. So this graph shows the main support that was provided to clients as recorded by advisors in the advice logs. So this is advisors that were supporting both money and welfare rights advice. and it shows that benefit entitlement checks, income maximisation, and support completing application forms were the most common activities carried out by advisors. And these were the sort of typical activities that service leads also noted as being standard practice within these services. Some advisors within the advisor logs did also note that part of the support they provided during the day included administrative tasks and casework that maybe didn't involve direct contact with the client. And they were supported an average of 6 clients per day. And the service leads within the survey noted that type 2 sort of casework type cases was the most common type of advice provided normally. So this graph is taken from the advisor logs and focuses on the time taken to support individual cases during the day. So it shows that the majority of cases, advisors spent less than 1 hour on that case during the day. But this does vary based on whether the client's new to the service. So clients that were new, on average, the advisor was more likely to spend more than 4 hours during that day when compared with returning clients. And there was also variance based on the contact method and the main issue. So if the contact was over telephone, the advisor tended to spend longer. And then if the main issue was debt, then again, the advisor tended to spend longer. So this only shows how much time was spent on the case that day, so not necessarily how long the actual case took to resolve. So it's possible that advisors only spent a short amount of time in some cases because they've done all they can with the information that they had at that moment, and so move on to another client whilst they wait for more information. So some advisors did note that throughout the day they would be making calls to clients to seek information and couldn't always get through. Therefore, a short amount of time may be spent per client, enabling advisors to support multiple clients throughout the day, but overall the time taken to complete the process can be lengthy. So service leads did notice that the process, it has been quite long, particularly due to administrative burdens. So these have been exacerbated because of the lack of face-to-face and delays in receiving information. So things like waiting for clients to sign forms and get them back, and then if administrative staff were only in the office, say, once a week to collect that information, then that added to the delays. And then even dealing with other creditors and other organisations, with everyone working from home, it's all just been taking longer than normal. So services have been looking at ways to reduce the administrative burdens and ensure that advisors can focus on formal advice work. So successful outcomes are regularly achieved for clients. So in the advisor logs, successful outcomes were recorded for 39% of the cases dealt with during that time. And many advisors also noted that whilst a successful outcome might not have been achieved during that day, a lot of the time it was expected. And improved health and well-being and other non-financial gains are routinely achieved according to service leads. So this graph shows of the survey respondents, they were asked what non-financial gains are routinely achieved for money and welfare rights advice clients, and tenancy property retained was the majority of respondents said that was routinely achieved, as was signposting referring clients to additional support. And then a smaller percentage also said that the prevention of legal action was routinely achieved. So service, I mean, these outcomes are not only significant to the lives of clients, but can also enable substantial savings to other public services. In addition to the typical advice activities carried out by advisors, money and welfare rights advisors also routinely offer additional support. So service leads noted that some of these additional activities often include signposting and referrals, other areas of advice, financial skills training and early prevention work. And in the advisor log cases, additional support was offered in 22% of the cases there. So this just further highlights the value of these services in enabling clients to access everything that they need from the service. So, like I'd mentioned, there's been a change in complexity over the period. So service leads had noticed that there was an increase in clients with mental health issues. So advisors are having to work under significant pressure and have been extremely resilient through the ongoing challenges that we're all facing at the moment. And so they've had the complexity of individual situation with the increase in clients with mental health issues, change in economic landscape, and then delays due to the lack of face-to-face have all increased time taken. So if you look at this graph, this shows service leads were asked since the start of the pandemic, has there been any change in the average length of time supporting clients? And the majority said that there had been an increase, with 70% saying that it increased a lot. And they just noted that the advisors are having to provide social support over and above what is expected. And in some cases, they've had to cope with clients ending their lives, which is particularly challenging, especially when you're working from home. So there has been a lot of challenges facing the sector during this time, but they've continued to offer that support and be there for clients. So, like it said, the service delivery changed overnight, and in October there was still service leads were noting that face-to-face continues to only be offered in exceptional circumstances. So if you look at this graph here, this shows in the advisor log cases how the contact was made, and the majority of these were over telephone, with only 1% being face-to-face. So although there's been this massive shift, it has just shown that this is possible. So although services have been offering different contact methods for years now, this is the fastest it's shifted so significantly. So it does show that it is possible. In terms of demand facing the services in October, so there still hasn't been the surge in demand as expected. So despite the fact that this sort of research was carried out around the time that sort of support measures were starting to be wound down, service leads still noted that they hadn't seen a massive increase, and they felt that they would start just sort of slowly picking up pace. But there was a concern that although there hasn't been a surge in demand, there's likely to be people out there that need advice that haven't sought this out or have been unable to do so because of the changes in service delivery. So services were quite keen to ensure that in the future they're reaching some of these most vulnerable groups. There was an emphasis that face-to-face support that is still needed and should return in some form, perhaps in the hybrid model. So they were keen that it returned, but they were still retaining the efficiencies that we've had because of the lack of face-to-face. So it's shown that there's a massive reduction in travel time for advisors, not having to go and see clients. There's been electronic forms that enable some clients to do things for themselves, which can then allow services to support those who most need it. And services are also keen to deliver more preventative work and build on financial resilience. However, there was concerns about stable funding and capacity to do these things, so particularly capacity. So service leads asked, 44% said they had sufficient capacity to test new approaches. And when discussing this in interviews, it was noted that the recruitment has been a concern, as services are often having to advertise multiple times as they just can't get the people with the relevant experience. And then even if they are able to recruit, having to train people online means that they're missing out on a lot of the informal knowledge that they might have gained from being in the office. So there's a lot of work that services are keen to do, and they want to get out there and be doing more things in the future, but they're very aware of that this has to be done within the capacity that they have. In terms of debt clients, debt advice also showed a reduction during this time, but many service leads did say it was starting to return to normal levels pre-pandemic. So looking at the advisor logs, 35% of the clients in these logs had outstanding debt. This increases to 64% if you also include advisors who only supported money advice clients. So it does show that there is a large number of clients with debt, and this is likely only the clients where this was asked about, so there could be more people with debt. But what was most concerning is the relationship between outstanding debt and deficit income. So the graph shows within the advisor logs the proportion of clients that had outstanding debt who also had a deficit in their income, and there was 70% of clients had both. So this just highlights the vulnerability that many clients are facing with having to choose between paying for their bills or paying for their debt. And there was a concern among service leads that this could get worse as debts could be building up. So although there was payment breaks, there was still interest charged. And so now that these are starting to resume, it might just tip some people over the edge. So we asked about what services were doing to deal with the fact that there might be an increase in debt clients. And 33% of survey respondents said that their service had engaged in new outreach activities aimed at promoting the service to people with debt. And so while some outreach work has been done, it has been fairly limited due to the restrictions around face-to-face contact. So services felt that they were unable to build the same physical presence that they may have done when they were doing drop-in sessions and such like. However, they're still keen to do so and are making sure that they can do what they can within the restrictions that they have. And services did mention that there is that amongst like local authority services and other organisations, they are better connected, and there's been greater awareness and recognition raised within council services. So there has been a lot of work to ensure that people are aware of what's available, and it's hoped that this will continue going forward.